whatever is missing also, I'll tell you. Okay, shall we start?
So, Mrinalini Didi will be the moderator for the day today.
Yes.
Isn't it? Yeah.
Anchor can introduce and then we'll start.
The slide thing, Didi, you are going to present, or what has to be done?
Bhaiya, I'll be presenting the UHV point also, Bhaiya. And
So
today
you'll be
I'll
sharing the slide.
my screen. Yes, Bhaiya.
So I'll stop sharing from my side.
Okay.
We will start. Namaste. Good morning to all of you. Warm welcome to this day 3 of the international conference, where we will be discussing the holistic health. This is Deepesh A. I'm in the role of regional coordinator of the Southwestern region of NCCIP-AICT. Right now, I'm speaking from Kerala, right? So it has been an enriching discussion phase for the last 2 days, where on the first day, we discussed on the need, and the second day, we discussed on the vision. And today, we will see how we can implement this value-based holistic human health. So in today's discussion, we have Dr. Mirunalini Gunasheelan, who will be the moderator of the session. She is a assistant professor in the SRM Institute of Medical Sciences, Chennai. Let me warmly welcome Dr. Mirunalini Gunasheelan for taking over. Namaste, Dr. Mirunalini. Over to you. Your mic is mute.
Thank you for the nice introduction. And I welcome all the panelists and all the delegates who are present here for the day 3 of our panel discussion, which will be on implementation of value-based holistic human health. So before we begin, I quickly introduce all our panelists who are present here. We have with us Dr. Swapan, who is the Director of Students' Welfare in his institution, and he's been taking UHV classes since 2020. And we have Dr. Deepesh with us, and we have Dr. Shrija and Dr. Sharmila Astana. So with this quick introduction, I once again welcome all the panelists. Now, before I go into this viewpoint of implementation, I just quickly recap about what was done on day 1 and day 2. So on day 1, we saw about the need for this holistic health, and there was a general consensus at the end of the panel discussion that there are many gaps in spite of the advancement in medical technologies in the healthcare system, and there was a need to look at healthcare in a different approach, maybe in a holistic view. And on day 2, many concerns regarding increase in the stress, lack of adequately responding to the mental health issues, sustainability, increased cost were all discussed, and the role of self in maintaining the health were all discussed. And many programs were proposed to go into this vision. And now, coming to day 3, I'll be quickly putting before you UHV viewpoint on implementation of this value-based holistic human health. And once I finish this, we'll be starting our panel discussion. So our panel discussion, like the last 2 days, will be for a period of 1.5 hours. And each panelist will be posed with 2 or 3 questions. And for each question, you will be getting 3 minutes, and the clock will be on the right side of the screen. So I kindly request you all to please stick to the points and to the time so we can cover as much ground as possible on this topic. And at the end of the panel discussion, we'll have a 10 minutes question and answer session with the delegates and also among the panelists. And after that, with a short summary, what all was discussed today, we'll end the panel discussion session. Baya, now, how do I change the slide? It is not changing.
Didi, you can click on the slide and one click it will go, or you can use the right arrow. Oh, yeah. It's moving.
Okay, so yes, yeah. So now let me quickly give you the UHV point of view to set the stage for today's discussion. And our conversations and our discussions are going to be revolving around these topics. So when we look at how human being is viewed, we have this body-centric approach currently in our current healthcare system. The human being is viewed as the body. And when it comes to health of the body, since there is a lack of understanding about human being, we rely mostly on the tests and labs for detection of diseases, and we rely on medicines and treatment for supposedly curing the diseases. And sometimes these medications are taken lifelong. But this question is raised, are we really addressing the root cause and are we really curing the diseases? So for addressing this gap, we propose a holistic approach to viewing health and human being. So in this approach, human being is viewed as a coexistence of self and the body, where the health of the self is given the number one priority. When the self is healthy, it naturally takes care of the health of the body through nourishing, protection, and proper utilization. And the healthy self also takes care, leads to a healthy environment in which the human being is a part of, that is, the family, society, and nature. And we also proposed certain programs for staying healthy, the physical body. That is, the first priority would be to give proper intake of food, water, air, sunlight, and proper lifestyle routines, daily habits. And the second would be to incorporating labor and exercise, and then for good postures, for regulating the internal and external organs, and regulated breathing. And medicine and treatment can be relied upon as a last resort. So, going into understanding a little bit more about this proposal on holistic perspective on human health, we need to understand the mental health or health of the self, the physical health or health of the body, and the conditions for mental and physical health, that is the health of the environment. So, when it comes to mental health or health of the self, we need to understand the human being as a whole, and understanding the self will lead to harmony in the self and a healthy self. And we need to understand about the human body for having harmony in the body, which will lead to a healthy body. And finally, we need to have an understanding about the environment in which the human being is a part of. That will lead to the harmony in the family, harmony in society, and harmony in nature and existence, which will ultimately lead to a healthy environment. So, understanding all of these and seeing the relationship and harmony at all levels of existence will naturally lead to health in the self, health in the body, and health in the environment, and ultimately well-being of all. So once after this understanding, the next step would be to implementation of this holistic vision of health. So for this implementation, again we need to understand the holistic vision for health. For this, we need to understand about the universal principles of health, which are based on the fundamental reality, that is the way things are in existence. And based on these reality, we have some recommendations, and we need to follow these recommendations. And finally, with these recommendations, we need to implement them. And after this understanding, so some of the things which can be made use of for this implementation would be to take the use of this medical education and medical training, which are already in practice. So when it comes to medical education, we can have some sensitization workshops on UHV and holistic human health in medical education for faculties and students. And when it comes to medical students, we can include this UHV and holistic health, human health courses in their academics. And along with this, we can go in for more research on the self and consciousness, and we can incorporate this UHV and holistic human health courses and workshops as a part of CMEs in medical education. So incorporating this UHV and holistic health outcomes as a necessary requirement in medical codes or manuals of medical health will be a useful practice for taking this the long term. So this is in short about the long way for implementation. Now the first step here would be to prepare the faculties to for this implementation in the long run. So for faculties, we have many faculty development programs when it comes to UHV, Universal Human Values, which aims at a holistic human world as the vision. We have introductory UHV faculty development programs, which can be a 3-day face-to-face program or 5 days in the online mode. And next step would be to take it to the UHV2 faculty development programs, which is again a 5-day face-to-face program or 6 days online program. And then we have the faculty development programs on holistic human health, the vision of which is to take responsibility and develop the competencies to stay healthy. Here we have introductory faculty development programs for 5 days, either online or face to face, or we have a full faculty development program which is 10 days face to face. And under this faculty development program, the things which will be covered are the holistic view, holistic body-centric view of viewing the healthcare system and the human being, and universal health principles which are based on reality, and the recommendations regarding the holistic health will be covered. And some exercises on self-observation and self-exploration, which will help us in understanding the self and the body will be covered. And there is also a health tracker which will help us in tracking one's progress in health, will also be dealt with. So once the faculties are prepared, the next step would be to implement these courses for the students. And for students, we have in UHV, UHV 1, 2, and UHV 7A. UHV 1 is the introduction to the universal human values, which can be taken as a part of student induction program when the student joins fresh for any course. And next, to implement UHV 2, which is the foundation course in human value and professional ethics. And UHV 7A is a foundation course in holistic human health. So all these courses can be added on to the medical education system. And so once this part and courses are taken care of in the education, as an institute, it will be better to implement counseling and wellness centers where the public and the doctors and the students will be taking benefit of it. So holistic centers for well-being, they provide an integrative approach to well-being of all, in addition to the current system of medicine, health education and practice on how to stay healthy for all the patients, doctors, and staffs and students can be done. This can be implemented by setting up counseling services, integrated healthcare centers, and the aim would be like the responsibility of all towards keeping the self, the body, and the environment in good health to ensure well-being. So with all these implementations, we have a load of resources and resource materials that will help us in moving forward. So to begin with, the resources and support for implementing these workshops in your institution, we have many resource persons for training the trainers, and all the resource materials are available freely to all. A holistic human health book, there is a foundation course on holistic human health, its philosophy and practice is available as an ebook, and it is freely downloadable in this link uhv.org.in. And we have many other books, videos, and other resource materials which are all freely available in the website and is also free to be downloaded. And in addition to this, we also have many audios and videos of self-exploratory exercises, that is observing the self and the body, and sharing of participants after going through these exercises, where they have shared about their impact on their mental and physical health. This is all available in the YouTubes and in the UHV website freely. And other supports are available through our regional coordinators who are present for every region pan-India. And we have many nodal centers for UHV in various institutions pan-India. And the details of all of this are available in the uhv.org.in website. So, with this brief outline about the general vision and the ways in which implementation can be done, we'll now move on to our panel discussion for today. So, for the panel discussion, let me start with this question: the possibility of implementation of these courses in your institution. And for this, I would like to call Dr. Shrija. Dr. Shrija, as a healthcare professional, what do you see as the possibility of implementation of this holistic vision of health in your institution?
Yes, Mrinalini ji. Uh, Having attended the last 2 days where we have seen the need for the change and the vision, I really hope that it should be implemented in a positive way in our institutions. And the things which are proposed, like the different workshops for students as well as FDP for faculty, I look forward that how this should be implemented in a good way, and look forward for a positive change that we can bring in the health sector and the society as a whole. And I too would like to do my participation in my institution, taking this forward in a positive way. And I really see after the discussions in the last 2 days that there is a need, real need is there in the overall health sector, and we all should really try for implementing this. And the way all things are proposed here, the workshops and the way it has to be implemented, I think UHV team has done a commendable work in this direction, and it would be a real help in implementing these things in our institutions. So I would like to do my part in this implementation, and hope so it would be done, and all of us together can do it. So that's what I have to say. Thank you.
Thank you, Dr. Shrija, for that positive outlook on this holistic vision. I would like to ask Dr. Deepesh, what do you think is the possibility from your side for implementation of this holistic vision in your institution in terms of preparing yourselves through workshops and FDPs and introduction of the courses for the students and developing holistic wellness centers in your institution? Dr. Deepesh, your mic is muted, I suppose.
Right, thank you. So it has been nice discussion what we had in the last 2 days. And we are able to see that the need is there. And yesterday we put forth the vision part also. And pretty much it is very clear that there need to be some shift in terms of the trajectory which we are having right now. So coming to the implementation part, I would say that since this is kind of a paradigm shift which we are proposing right now, so it may take some time in practical difficulties, and a lot of steps has to be taken to implement this in our institutions, because in our institution, as I understand, we don't have this exposure to the holistic pattern which we are proposing, and we are in the conventional mode as of now. So which means that the first part, I would say the implementation is for me to explore this. I have seen the resources which you have shown in the slides about the UHV YouTube channel, the textbooks and all other resources. And talking to people, I've got a good connection with the people who are practicing this. So I would definitely interact with some of the people here get connected with it, try to understand that. So that would be the first part which I will be doing as part of implementation. And then probably in a 2 weeks time, I will do that. And after that, what I will do is that I'll try to discuss this with my the academic council in our institution, put forth this in a proposal form with a detailed report about what we have discussed here and my understanding regarding that. And then I'll try to, get this courses for our faculty, starting from the introductory course. So it might be giving an awareness for all our faculty team in our institution, so that then we may get some very good informations from each one of them in detail, like how to be implemented, probably the geographical location and the institutional the location might have its own practical challenges which it be put forth, which we need to customize it on the basis of our institution. So I will put forth, I'll give that awareness to the teachers. Then we'll take their inputs also, formulate a team in our institution, and then go forward in implementing this as a step by step. But it's a long way to go. But what I'm trying to say is that the first few steps I'm trying to put forth here. And once we reach there, we will see how we can take it forward. Yeah, that's from myself.
Thank you, Dr. Dipesh. Though you're open up to implementation, I can see you have many concerns with you. So we'll go on to Dr. Swapan, who has been already implementing these courses in his institution. Dr. Swapan, we would like to hear from you about the way forward, like how you took up this implementation part in your institution.
Good morning to all, and very nice discussion going on for the last 2 days. Yes, as Dr. Dipesh is saying that it is not this course has not started in their institute, but we are fortunate. I am fortunate that this course is being conducted in our Punjab Technical University since 2011. So, but then there was a challenge in the beginning because teachers are not taking this course that seriously sometimes, because we are not getting even the core teachers sometimes for the core courses. So it was a challenge in the beginning, but then slowly, I think few teachers took it seriously, and then now we have developed a team. At least means there is a team in which the teachers have attended the workshops, also this UHV2, and even I attended UHV3 also last year. So I think now in my institute already we are moving forward and with these proposals because right now 1,400 students are studying this course even in this semester. So my observation is this, that teachers still have a little bit resistance because they have more preconditionings and they are busy in their own core courses. So sometimes they feel that it is not their own course. So then the way forward is only this, that I have to conduct more and more workshops where the resource persons who have done a lot of research, they will come. And that already we have planned. In this coming December, face-to-face, we have already applied to AICT, because the key are the teachers. Because last semester means I could not get that team, so then I had to put in a lot of efforts, like 27 hours workload I took in the last semester. But this semester, and then people started looking at it because I took it very seriously. Then people see that, okay, there is one person also, although you are being labeled as human values person, that also is a challenge. But then because I found by doing the self-exploration that, okay, this holistic approach, as we have been talking about the last 2 days, means now the time has come, the shift has to be there, but then we have to do a lot of research on ourselves. So I did that. I did a lot of experiments, and that gave me the confidence, this concept of self and body. I am responsible for my body. So in that way, when I go to the classes and then the team also I'm talking, but then I think a lot of workshops have to be there face to face where teachers. And then one thing I found that students have a lot of curiosity, means they are listening to these proposals first time and their preconditionings are less. So I found
Dr.
teachers.
Swapan, it's really nice to hear you talk about this. We'll come back to you again with more of the challenges you face. Perhaps that's throwing in more light to us. Now, just to give scope to other panelists, let me move
Yes.
on to Dr. Aprachita.
Nice.
Thank you, Dr. Swapan. Dr. Aprachita Singh, do you see any possibility of you pursuing the implementation of such a vision with the regulatory authorities of your institution?
Can Abrachta Didi come on video also? Because her video is not visible here.
Dr. Aprachita, your audio is muted.
Didi. Namaste. Namaste, Didi. You will have to repeat because we just went to have a glass of water and I couldn't listen to you. Yeah.
Yes. So, do you see any possibility of pursuing the implementation of such a vision with the regulatory authorities and policymakers of your institution?
Yeah. Though such kind of a subject, we as teachers are maybe not having a lot of idea as to how we have to implement it, but I do see that a lot of potential in this content. And whatever is being said, like we do want our students to understand that, as well as the faculty itself to understand that. And as I can understand that it is going to take time. A lot of training is also required. Like uh, instantly, I also have a doubt as to how the teachers are going to take it and how the students are going to take it. But however, I feel that it is important. We have to address these issues, and whatever problems are around, somewhere we'll have to tackle them. And this should be a good beginning. That is what I am thinking. Yeah.
Thank you, Dr. Aprachita. Now, going back to Dr. Swapan, I did interrupt you in between when you were telling more about the challenges. So, can you now point out the specific challenges that you faced when you started implementing these programs in your institution? Like,
Nice. Thank you once again for the opportunity. Means this is what I was telling, that this word human values, sometimes it is in back it's on our mind that, okay, can this be taught first of all? So that is a big challenge. That is a big challenge for everyone, each one of us. Even it started in PTU 2011, but then I started looking at it around 2020 when the corona happened. And before that also, I saw that workshops were being conducted. Our PTU, Punjab Technical University, was taking initiative and they were trying to have a lot of workshops. But then teachers were being forced in a way to do this. So, but then how many teachers took it seriously? I'm not sure. So this is the big, I think, challenge. Means all the teachers who are taking it, how seriously, how much there is the priority for them. So, and then even the students, like they come from different backgrounds. Sometimes they also question. I have talked to them when I'm teaching them, that they said that how this course, means if they are doing BTech or MBA, they're interested in all those, their skill, and that is how they are being trained. So then for them also, they found that how this course is there. So there's a resistance, I think, in all of us. And even you see the higher authorities, they also in a way means they feel that, okay, how can this be done? Is it practical to see the holistic? Because we are not doing the research on ourselves. We are doing a lot of research on the material. Last 2 days we are discussing. So the whole perspective, it's a huge challenge. But then, because when I started doing the exploration, then I found it beneficial for me. So then it's a slow process. So I'm taking it in that way. It's not easy. But then challenges there. But then this is the only way forward. Like last 2 days we are discussing. But I feel that there is a hope that all of us will understand. So there is a challenge, but then I think the higher authorities, they are sometimes not giving the time for all these workshops. But I think the new education policy, which is also laying stress on all this. So in that way, I think they are also now finding the importance, but then it's again a slow process because we are basically skill-based education. So that shift has to come. So it is a challenge, still a challenge, but then I see because in our institute, UHV is already there. So for this holistic health also, I look forward that workshops can be conducted and then we can look forward for holistic approach to the health also. That's from my side. Thank you.
Thank you, Dr. Swapan. So I can see you have undergone many challenges like resistance from faculty, students, and management of time and all for implementation. Perhaps you could throw us some light or some specific incidences which you had, like how you overcame each of these resistance, like how you were able to convince your faculties, how you were able to convince your authorities to spend some time for this, give you some time and infrastructure, maybe about how you were able to obtain the resources and funding for conducting these workshops, and how you went about contacting the resource person, something like that. So maybe it will be useful for all of us
Nice.
to implement in our institutions.
Yes, very nice question. Yes, that is what I said, that in the beginning, even I was finding it difficult. I knew that this is a holistic solution because we could see the problems in the institute. Like the students are facing a lot of issues, relationship issues, teachers, we all are in behavioral issues. Even I had that. So it was not easy, how to go about it. But then I said that already I've said that this course was mandatory from the point of view of the PTU. So there was always a lot of support from their end, like our PTU. There is a whole team in PTU, so they were always reminding us. So that was, I think, a very big, very nice point that they were reminding us from time to time that send your faculty for these workshops. And even when the teachers went there, so they found that 8 days, then when the face-to-face workshop happened, that they found that it is nice, but they were not sure whether it's practically implementation or not, because there are a lot of proposals coming from outside also, which are influencing all of us. So whenever I found that whenever they come from the workshops, they used to say that, okay, it's very worthwhile, but then it's very soothing for those 8 days, but then how to implement it. But then I started doing, means experimentation is very important, experiential validation. So it takes time. I think then I started doing it, my experiments with myself. And then especially I found that even my body had issues, constant headache was there. And then when I started exploring this concept of self, and then I found that I am responsible for all those contradictions and complaints. So when I took the responsibility of myself and this concept of self, so that gave me the confidence. My body issues started resolving by itself. So I think, and then again, the teachers, so I'm talking to them continuously, and they are also looking at some of my colleagues, even my senior people have told me that now we found you that you are more stable than earlier. So it is your conduct only. I think it will take time. You can't preach it. I'm very sure. You have to give them as proposals only. And like in the last 2 days, we are just giving them the proposals to all our delegates also. So I think all of us have to do research on this. Only the research can make me confident that, okay, it is worthwhile. And then obviously, then there is no other way. You will take it forward and in the form of proposals to the people. And I have already told you that students take it even more seriously, because sometimes they are in initial few days, they are saying that what is this? But then slowly and slowly, when you share with your experiences as a teacher, so teacher is the key. So I think this is how I took it. And then with my conduct, people are getting confidence in me. And now they are listening more to this, and because they are also finding there are a lot of problems. And then when you become solution centric, people come to you, and they also say that, okay, although they label us with the human values, but then when they are finding the solutions, then I think they have to look, they will look. And I think that is the key. Means you can't do it in a hurry. It's a slow process, but I have to work on myself, and then the way forward will be there. The team will be there. Thank you.
Thank you, Dr. Swapan. We did get many insights from you, how you overcame these challenges. Like the first point would be for self-transformation, self-exploration, constant communication with the faculties, setting up a team, asking the faculties to attend the workshops and so on. So with this motivation, I would like to ask Dr. Deepesh, what is your willingness to participate and your commitment regarding setting up these courses and workshops in your institution and setting up this holistic wellness clinics in your institution?
Right. So, if you ask me my commitment, then I would say that definitely the commitment is there. But when you, on the other hand, if I was thinking about the commitment in terms of the time I can contribute to this, see, before I take part in this conference, we have been already overloaded in variety of ways in terms of work. So all of a sudden, it would be difficult to take out a lot of time and effort for this work. But then again, as I said, at least I would take some personal time for time and effort to understand for myself, first of all, so that even now I have a lot of queries and concerns in the implementation. When you talk about in the practical part, even Sopan was actually mentioning how with that years of effort, how much challenges they have faced in implementation part. So while talking also, I was thinking about what are the challenges which I may have to face when taking it forward. But then again, I would say the commitment part is there, definitely from my side. Definitely, no, at least I'm quite impressed that this program is being done by the volunteering of the UHV team. So which means that this is doable. That is, I never felt that is a kind of working model, like people along with the work trying to achieve so much of output and outcome, even for a paradigm shift which is being proposed here. So that means it is doable, and I think we need to definitely, which is doable means we can also do that in our institutions also, and probably that part also, I would say, to take it to my institution, the kind of the working model, which is kind of volunteering model, apart from their usual schedule is there, and along with that, I was quite impressed the way you are conducting this international conference in this manner, and many aspects which I have noted that you see that you an unconditional way of working model which the UHV team is proposing. So definitely I'm committed from my side, and would like to pursue it in that model. Yeah.
Thank you, Dr. Deepesh. Now, Dr. Aprajita Singh, what would you say are your commitments taking this forward and to establishing holistic wellness centers in your institution and ultimately making your institution a center for holistic well-being?
Yeah. Though I said that there are challenges, but I see that how I can help establish this, communicate this to the decision makers at our institution, because the how I think people are waiting for such a content, and gradually, as it is becoming their priorities, as we can see that so many volunteers are doing this work, like it is evident that the effectiveness of this content is evident through that also, I think. So only what, firstly, I got to involve a lot of my decision makers to look into this content and the importance of this content, and gradually happen to percolate down the line, the hierarchy, so that everyone is able to see the effectiveness of this content, and it is going to make a difference to our environment, our mental and physical health also of the individuals working in the institution, as well as whomever they come in contact with. So I see how gradually we can, and how others have done it. If we can get some idea as to how other institutions have implemented it, maybe if that hand-holding is done, I think we can also see how this can be implemented at our institution. So I just look forward for guidance from the team over here, so that I can just, how do I go about, what should be my roadmap? I can make it clear, and I don't want to rush into something so that we get a lot of opposition from people, a lot of resistance. So I just want to know how gradually people have moved into it, how systems are to be developed, so that this happens to be taken by people in a positive light, and a lot of strength happens to get into the complete flow of this process. So I just look forward for that.
Thank you, Dr. Pujita. Like as I was presenting before, we have this website uhp.org.in. You have got lots of resource materials, and the way forward for implementing this and all the guidances you can get is really available there. So if at all, whenever you're planning to implement this, you can go into that website and get in contact with the nodal persons in your site, in your place, and I'm sure they'll be guiding. So thank you. Thank you for all the time we have spent here. Now we have come to end of this panel discussion. And now for the next 10 minutes, this forum will be open to all the delegates and attendees who are present here. For any doubts you might have, it can be asked to the panelists, or even within panelists, if you have any doubt, you're free to open up and ask anybody who's present at this panel discussion. Delegates who are present can post your questions in the question answer icon, which is present there.
Yeah.
Please go
May
ahead.
I? Yeah. So I just wanted to know, like, this is taught as a subject. This is not like that those regular subject. How do we see that this content is being understood by our students? If it is just an examination form, just producing answers to the question itself, is it going to help them really bring about that change in themselves, or that kind of a change that we're expecting? So that kind of a question. I don't know how to see, how to assess the students. That is what I was thinking.
Would you like to ask this question to Dr. Rajita?
Yeah, anyone would be
Yeah,
okay.
I think Dr. Swapan can answer this since he's been.
Yes, very relevant question by Dr. Varjita. Yes, again, if you will just to have a means monologue, it will not work. I think the best part about all this holistic approach, because people have not listened to these proposals. So it's always in the proposal form. So we always can say that we are co-explorers. I am also exploring. You also see what is the reality. Do you want a solution centric approach, or you want a problem centric approach? So give a lot of examples can be given in the class. And then what I found, the projects are very important. Today, even the education policy is saying, let's go beyond the classroom. So I think projects can be very relevant. I found that even I found after this experimentation that your projects also become very relevant. My thinking also thought that, okay, how can we help the society? Like so projects are very important. So I gave very relevant projects. Like in our area, there's a trend that children are living like India. We are known for the joint families, living and settling in Canada. So I just gave them the project that how these old people who are living behind, how are they coping? What are their feelings? and they found it very interesting. And then from the nature point of view, because we are discussing a holistic point of view, can we give it to the students? So then we gave them this project of, okay, how can you make the nests for the trees, and means they can be kept on the trees, so that these all units, are we feeling related to them? They also have the relation. So in that way, I think it can be taken forward. But first of all, I again say that the teachers have to be very well prepared, and then they will start. It's automatically the process will start. You can have a lot of projects which will make them even more insight, which will give them more insight. That's my take on this. Thank you.
Thank you. Thank you so much.
This was your question answered, Aprajita, or was your question something else?
It was like, how do we assess the students if it
Ah.
is just a subject? Like, no?
Ah.
Yeah.
Okay, this is how, again, on the basis of the projects, and even if they are asking questions in the class, so queries, it's not only that they are writing the exam. Even writing the exam, I think we can be more not straight questions. We can give them the case study or the situations where we can see that whether they have understood these proposals or not. So this is my take on this. Means it's not that only the people who are writing well. This is what our courses have been, that we judge their intelligence from the writing, but even we can mark them if they're interacting well, they're asking questions, because it is on the dialogue based, proposal based. So that also can be. Then the project also, you can have their sharings, like even we did the video or of their sharings, that what have they understood, and then we are marking them, then we are assessing them, not only on the basis of the written exam and all that. So the sharings also brought a lot of insights. I have got those videos with me where they are sharing, and we judge them with that, where they have reached. So that is how we assess. I think now I have answered.
Didi would want to add something?
Yeah, I was just thinking that what about more responsibility in their behavior? Would that not be a consideration?
Yes, yes.
So,
That is again from the sharings also, and even I see in the class also, like I did the experiment, let's have a 2-hour class. Earlier, they are not ready even for 1 hour. But then they also become, means even in other activities also, when they're going for the projects and all, they're discussing with me, because when they find the relevance and they're taking more responsibility, even some situation crisis happens in the college. Sometimes I found that the students have come forward for that. So in a way, they are means it's not means that easy, but then you need a team. That is what I'm saying. The all of us have to be on the same page. That's very important, because one person can't do it and do it in every class. So team is very important.
Swapanji, one
Yes.
thing, when somebody is asking a question, what you can do is try to note down
Okay.
what kind of points you are going to say, because
Right.
it's getting very spread out. To find
Okay.
the answer in that becomes little difficult. The
Okay,
question
Didi.
is directed, no? Like she
Right.
asked, how do we see if students have understood?
Okay.
This what was her question, right?
Okay.
So how are you going to tell that somebody has understood what they are talking? So even what we talk about, one is you can assess through your regular examinations and things. What about the theory they have understood? But then this
Right.
goes beyond theory. So then it would have to do with their behavior. If they are showing
Right.
more responsibility in what they are doing, say they have improved relationships at home, or if they are taking more responsibility at home or in their classes, maybe doing better in academics. Some of those signs you will see that you should mention, I think.
Okay.
No, don't
Okay.
you think, Aprajita?
Yes. Yes. Yes.
I think Bhaiya was saying sharings. Now he didn't mean that only, but he could come to something specific,
Yeah,
as you
because
said.
see,
Yeah.
when we
Okay.
say
Okay.
sharing, I don't know if a newcomer will understand what you're trying to say.
Okay.
है ना? So make some
Mhm.
specific points. I felt even when Mirunalini ji asked about the challenges. No? Try to see what kind of points, like if I have to ask you, what were the 3 most important challenges you faced? What would you say?
The first challenge was that even myself, I was not sure, first of all,
Okay.
that whether it is means when somebody proposed me that, okay, can you take the classes? The first challenge was this, that how will I work on this? And
Yeah.
how will I go about it? Because that was the first challenge, that means whether I will be able to do it. So in
Okay,
a way, I was little.
don't elaborate on that. Just
Okay,
take
okay,
that.
okay.
What
And
was
then
the second?
second was again the resistance of the people around you. Like whenever
Hmm.
you talk about the human values, people take it like, what are you talking? Means they don't they don't feel that it can be taught or like that. It is already there, and it's not our job.
Okay.
Sometimes they this is how
This
the
was second challenge. Third
second
challenge?
challenge. And third is again even the atmosphere in the students also. Like if you go to the students, they also feel that why this course has come to them, because already they are into BTech. How this human values course will help them? How has
Okay.
this come? So they are taking it very lightly.
So now you mentioned a challenge. One is within you to
Yes.
really be able to be convinced about it, or how you're going to
Yes.
go about it. Then a challenge in terms of other faculty, and challenge for the students also to see this or be convinced about it. This is what you said?
Yes. Yes.
Okay. Now, how did you overcome some of these challenges? These
Uh,
3 challenges.
First of all, again, I found that first of all within me, that I have lot of issues within me and they are not being resolved. So only temporary solutions I was finding, but it was not resolving me within, and then it was telling on my body also. That I told you that constant headache is there.
Yeah.
So then, but when I attended workshops, I got the glimpse that this can be the possible solution. But then again, uh, so then I took it because I thought it's now high time that I start looking at it. Otherwise, it will be not able to manage myself, and my relationships were also suffering. So then I took it again. The Corona, that's what I'm saying. The turning point was Corona, when we took a pause, and then it came again, and then I think the journey started, and then I started teaching the course. Then really, I think,
So
because you
here
can't stand.
you should not be highlighting Corona came and
Okay.
we took a pause. You should be highlighting my attention went to myself and my relationships are not fulfilling for me. And so when you brought about, you sort of looked at these proposals in more depth, you saw the changes in yourself,
Yes.
isn't it? That's how it
Yes,
went
that
about, isn't it?
that gave the confidence.
So that point must come out.
Right.
So you put your Joby, whatever question is coming, try to see point wise, 2, 3 points, and how you overcame those challenges. So
Right.
one is that you worked on yourself.
Yes.
You took those proposals and churned them inside you. You explored on them. You found that it helped in your relationships. You found that it helped in your physical health. So then you were convinced. And then you
Yes.
found it easier to help others also. And
Yes.
similarly, other faculty, when they saw you become more responsible, your behavior changed, then they were more keen to look at it. Students
Yes.
also,
Yes.
same thing.
Yes.
So
Yes.
ultimately, actually, it is the same thing that is happening. But we must draw it out for those who don't know this. Because
Right,
we are
Didi.
seeing it day in and day out. So we get used to that. But you must point out those things. You know?
Right, Didi.
For a
I think
newcomer, that is important.
I have to overcome this, that I go much in detail. So
Don't
that
go
is, I
into too
think.
much detail, because
Right.
if it spreads out too much, to get the essence of it is difficult. So if you put it point wise in yourself, you'll have more clarity when you say it.
Right.
Now
Right.
try it out and see.
Means I have to overcome this sanskar of means elaborate. I go much in detail. That is how this again is one of the sanskars I can see
Matlab, it gets all mixed up, I feel.
mixed
I
up.
find it
Okay.
difficult. I don't know about others. I find it
I mean,
difficult to try to tease it out.
I think the way out is that you have told me that I will keep a notepad with me.
Huh.
I'm not keeping that. So I
Huh.
will do that. Whenever the Tuesday next rehearsal, I will keep a new notepad and I will note down a little bit that which points
Yeah.
have to be said.
Yeah.
Nice.
Thanks.
Nice. Nidhi.
Yeah, I think
And-
Miruji should do the session more often because I got some pointers about what I need to change also in the slides. Like something like this question that we are asking, we are starting with workshops and all to do. But the first question should be, would you be interested in getting to know more about some of these proposals? That should be our first question, I think. So I will add that there. Because for somebody to commit to workshops and all, when they don't know the content, it's difficult, which Aprajita ji also pointed out later. I mean, I was writing it and later she also mentioned that. So you always want to know a little more. So first question should be, would this be something that you would be interested in knowing more about? Only if somebody says, no, we are not interested, which is going to be rare. Then once they have accepted that they want to know. Now, if you were given this opportunity and you could attend the workshops, supposing you felt that it was desirable, then we should put the next question that, would it be feasible for you to take it to your institution and all those things. So I'll add that in the questions. The other thing I was thinking is from the point of view of a newcomer, somebody might ask, from where has all this come? Like, where are you getting these proposals from? What is this outlook? So we need to be prepared with some answer to that. Yeah, I think a simple solution is if you go through the book, Human Values, you will find all the references in that. And yes, there has been a lot of background to it. And in fact, what we are looking at is the way things are, the fundamental reality. So the reality is the same. Different approaches may be there. This is one approach where we are trying to bring it into education. So an approach which would be suitable for students. Something like that I was thinking. Somebody might ask this question. That was one thing. And another possible question probably to the panelists might be that how did you get introduced to something like this? So that part I think is simple. We've all just happened to come across this in our careers and we found it meaningful. It seemed to make sense, all of those things. It was logical and whatever we felt. No? That part can be the answer to that. Then somebody might ask about what is this two types of courses, the UHV courses and the holistic human health courses. What's the difference? So you can say that the fundamental reality, the way things are, that needs to be understood by us as the consciousness. And so the consciousness seeing this whole reality, that is the focus. I mean, this is how I see it in human values. But when we are talking of health, how that understanding would be applied to the health of the body, to my health, to the health of the environment, that application is in this holistic health course. So in that one, the focus is on how we need to be. What is our participation? All of that. Here it is more than just how we need to be. It is how to keep the body, how to participate in the environment in some detail where we are talking about health. So those people might ask. So I'm just thinking, or we can make some answers for these questions. And another thing that Aprajita ji pointed out, how to communicate this to others or convince the decision makers. So I think there again, the first thing I would say is for them to go through the workshop themselves, see if it makes sense to them. Then if it makes sense and they work on themselves, then it will be easier to talk to others. And what you mentioned regarding resources that are available. So one is the website, but we can also say that the human values courses have been implemented on a very wide scale, pan-India. So we have all these volunteers who are working. There are 500 plus volunteers who are doing this work. And there are regional coordinators in every region. So they can approach any of those people, and those resources are also available. They can contact these people and they can help them. So this is what I was thinking. What else did I want to share? I think that's about it. When you are when you finish with the UHV point of view, somewhere that when you start also the keynote, I mean the point of view, some connect should be there with the keynote. I don't know if I missed it or not, but something like we heard some of this in the keynote sessions, but here there will be a little more elaboration so that that connect is there from the previous one. And few other smaller points that I thought, one was just a mistake, I think. You said holistic, body-centric. It is actually holistic, self and body-centric. But I think that was just a sort of, you
No,
were...
I think it's there in the slide. I think better from the slide I can give. The first slide, na? It is
On one
body-centric
side is the
proposed holistic
body-centric approach. On the other side is
Okay,
the
okay.
holistic self and
Holistic.
body approach.
Okay.
So we have to shift from this one to that one. That is the thing in the slide. The other thing you said about the courses, and I'm sorry, that is my mistake. It's not very clear in the slides. You said once courses are taken care of, then we can try to look at holistic wellness centers. But I would say that this will go hand in hand. The courses is for, people to be educated. But in our institutions, the health maintenance part can be taken care of with these centers. So both can go hand in hand. And also when we finish with that viewpoint, and when we come to the panelists, little bit more slight interaction will be required. It's like from there we came right into the questions, and maybe I'm doing it also, but I could see it when I'm just observing. So we need to have some connect between the end of the view, that maybe now with this kind of a viewpoint, this may be, something very new to what we have been taught. And so perhaps we can reflect on this, and we'll try to get everybody's feedback on this or something before we jump into the question, so that it connects with them. What else? I think that's all. Few things that I was noticing, that we need to improve some things and be prepared for certain questions, because questions will be there, and I think everybody will not be ready to jump into it. So we will have to be little, we'll have to bring out some things. So wherever possible, Swapanji, where is Swapanji? It's there, right?
Yes, yes, Nidhi.
So when it comes to anybody asking any question regarding your this thing, try to mention whatever you could see in yourself changes, because that
Right.
impacts people.
Right.
So even when you say it made a lot of difference, what is that lot of difference? Put it point wise for yourself when you write it.
Right.
So when you speak it, you will be able to mention this point, this point, this point. I felt this, I felt that. I was more peaceful inside, or whatever it is. I lost weight. Lost weight as in not an unhealthy loss of weight, but even though I lost weight, I was alert, I was active.
Yes.
Found I
Yes.
could do much more.
That is
All
the
those
reality.
things that you have shared, but you must say it here.
Yes.
Yeah.
No, I will note it down. I will
Yeah.
point by. I think that is very important.
Yeah.
That's
Because
very
you don't
important.
have
I'll work
much
on that.
time. And if it is
Yes.
spread out, you can't focus on what exactly was the point in that. So
Right.
you do it point wise, you won't miss too many things, and you'll be able to put in more in terms of
Right.
what is they are able to remember. Yeah.
Right. I will work.
Yeah.
I will work on that.
Yeah. Thanks.
Thank you.
Any other comments, Miruji? What your experience about anything of this?
Didi, one thing I felt is like other panelists who are not into UHV, they are having many doubts regarding this, especially when it comes to implementation. But since there is only one UHV panelist, I am forced to direct all the questions to him.
Yeah.
And it's like every time I'm going back to Dr. Swapan, Dr. Swapan. So
Yeah.
I thought maybe if one more panelist with UHV is there, then I can ask this and that.
Yeah,
It will
in the
not be like
night,
a
there is
monotonous
no
work.
issue because we have less. So please, by all means, get more people. We have less people. In the implementation part, we also have now Dr. Akhilesh Shukla.
For the morning.
Huh?
For the morning.
No, night.
Oh, okay. Only for the day 3 he is coming.
Only for day 3 he is able to come. So we said fine to that. Other than that, like I said, other people who are UHV people, if we can get few, because we don't have enough people in the night, we'll put 2, 3 wherever there is enough room. Day, there is an issue because day is full. But night, we can certainly do that. And we don't have much time. We should actually figure out who we have to put in the next, either today or tomorrow.
So for day 1 and day 2, day 3, we have 3 panelists. We have Eloji Rao and Vidya is there, Dr. Vidya is there, and our Swapan sir is there. The 3 people are fixed for all 3 days. And for day 4, we have Akhilesh sir.
Day 3.
Day 3 we have. So only on day 3 we have 4 people. Day 1 and 2 we have 3 panelists only. So if we can add 2 more on all days, it would be nice.
Yeah. Let's work on that. All of us, we can think of anybody who would be, suitable and would be ready to come. We can put them.
So I've also asked with my students, Didi, because my batchmates are all in India, but my students have gone abroad. So from yesterday, I'm just sending them messages. See if they reply, then nice. At least if one we can get from US or
Okay.
from my institution, I think one sir will be there. I think he'll be ready to join as a panelist because he is kind of very ambitious and studious to participate in all these things. Maybe the night timing might be an issue, but if it is okay to include one more from SRM who is not in UHV.
Can we go to backstage?
Yeah.
Let's go to backstage. All